Okay, so I'm about to do a breast augmentation on this patient, but she had asked me a question about a potential scar revision for a C-section that she had, which is a vertical scar, and that's really what I want to talk about, not her boobs. We're going to talk about this scar. And so I just kind of want to give you the same answer that I gave her. And when I go through a evaluation of a scar for a potential scar revision, I really look at it from three different points. And I kind of have a simple system. I just give everything one mark. So the first point that we look at is the scar flat or is it raised? And for her, the scar is flat. So she would get a point for having a flat scar. The second point we look at is, does the color of the scar match the surrounding area? And for that, she would not get a point because this is a much darker than the surrounding area. And then the third point that I look at is to see the width of the scar. So if the scar is wider, you don't get a point. And that's in her situation as well. So she only really gets 1 point out of 3 for the scar. And usually at that point, I'll say, okay, well, let's do a revision. But if in her situation, I recommended not to do a revision because the color of the scar I cannot control. That's dependent on her cells that produce a pigment, whether they're going to turn on or off after surgery. Hers have decided to turn on, so there's nothing we have any control over that. The scar is already flat, which is why we have the point. So the main issue then is this issue, and that is the width of the scar. Can we remove this scar? If we did, it would be removing this scar like this and closing the scar again. But if we did do that, I think most likely she would again pull on this line, because if I did a scar revision and closed it, it would just be one line. If we did that, I think she would pull on the scar on either side with her tissue, because her skin and her tissue is very good. Despite having a child, her skin here looks like she's never had children, and it has really good quality elasticity and is very strong. So what happens is, if I were to remove this dark area, remove that scar, close it in a straight line that would be narrow, over time it would stretch back to the same width, because the quality of her skin is so good that tension, that this is not going to relax and allow that to be a thin line. It's going to pull and it's going to spread the scar again. So for that reason, I said to her, I don't think it's worth doing a scar revision, because we don't have any control of the color, so it's most likely going to be dark. It's already flat, so we wouldn't be gaining anything. And the main issue is the width of the scar. But in this situation, I think her surrounding skin is actually too good a quality, and it would stretch the scar. The same thing I've seen, for years, is if you look at somebody, for example, if there's a 13 or 14-year-old child and they come in and the parents are saying, listen, we're concerned about this mole here, we want this mole removed, but we don't have any diagnosis, the dermatologist doesn't want it removed, they just want it removed for cosmetic reasons, or sometimes they're concerned, but they just assume that there won't be a scar. But the worst time really to operate on somebody is, in terms of scarring from a plastic surgery point of view with your skin, is when you're 13 or 14 years old, or that young teenage time, because your skin is so good and it's such good quality and it's such high tension that when you remove whatever it is, a little mole or something, it's going to separate and you're going to get a wide scar. And so that is why, I wouldn't recommend removing something like that in a young teenager. If you look at somebody who's 80 years old and they had a lesion, you're going to remove it and close it, and there'll be barely any visible scar, because the tension of that skin is just so weak and it's wrinkly, and there's not a lot of force that's, you know, pulling that scar apart, so it just stays there and you get like this little faint line and it heals perfectly and you don't end up getting a scar. And so I just want to kind of explain that to you. And I will say one final thing. There was a surgeon who I knew who retired, and we were sort of at like a little meeting, and somebody asked him and said, you know, what's one thing that during your whole career you thought was going to be really good and ended up not being that good? And he said scar revision. And these are the reasons for that sort of being disappointing for his career, where he thought, oh geez, you know, we're going to be able to revise all these scars. But that's a problem, is that if you've got really good skin tension, then the scarring is going to be disappointing. Thank you so much. Thank you very much. I appreciate that.